हेलो एवरीवन एंड वेलकम बैक टू माय चैनल। आई एम डॉक्टर आस्था हियर एंड आज का वीडियो बहुत ज़्यादा हेल्पफुल होगा उन लोगों के लिए जो कोई भी कॉम्पिटिटिव एग्ज़ाम्स की प्रिपरेशन कर रहे हैं, बी इट AIAPGT या स्टेट PSC या भी कोई MO के एग्ज़ाम्स। ऑल्सो ये सारे जो आज की वीडियो में टॉपिक्स मैं बताने वाली हूँ वो वाइवा में बहुत ही ज़्यादा कॉमनली आस्क्ड क्वेश्चंस हैं। सो पूरे वीडियो पे ध्यान रखना एंड let's start with today's video. As I said in the previous video, I'll be discussing few other symptoms apart from the 10 which I discussed earlier, which are useful for you in your theory exams for short answers, for MCQs in your theory exams obviously, then for your practical knowledge, for your Viva answers, and also इसमें से कोई भी एक या दो या कितने भी आ सकते हैं हमारे कॉम्पिटिटिव एग्जाम्स, AIAPGT, हमारे MO के एग्जाम्स और एनी स्टेट PSCs में, किसी में भी हमारा ये नेक्स्ट MCQ हो सकता है. सो वी शुड नो अबाउट देम. ओके, सो द वेरी फर्स्ट सिम्टम इज पैथोग्नोमिक सिम्टम. What is pathognomic symptom? According to definition, pathognomic symptoms are specific and characteristic symptoms of a given disease or clinical condition. Okay? And pathognomic symptoms are also known as pathognostic symptoms. ये मैंने एक जगह देखा है MCQ. What are pathognostic symptoms? ऐसा था MCQ. Choose the correct. Okay. So basically pathognostic symptoms are same as pathognomic symptoms. Simple terms में अगर बोला जाए तो pathognomic symptom is unique and characteristic of a particular disease. ठीक है. अभी फॉर एग्जाम्पल अगर हम एग्जाम्पल से समझे तो as per bodies in rheumatic condition is pathognomic symptom. We have the Koplik spots of measles in measles. The third example you can think of, chalo, Fisher ring. In Wilson disease. Okay. So basically pathognomic symptoms are specific and characteristic symptoms of a given disease or a clinical condition. ठीक है. सेकेंड है हमारा keynote symptoms. So the symptoms which are peculiar in a case and helps to find out a small group of remedies. Keynote symptoms are the symptoms which are peculiar in a case and help to find out a small group of remedies. Now there should be at least 3 keynote symptoms to make a correct homeopathic prescription. Okay? To make a correct homeopathic prescription. This I am writing it down each and every word for you कि अगर कभी वाइवा में पूछा जाए डेफिनेशन या थ्योरी पेपर में भी डेफिनेशन पूछा जाए, you should know the words and how to write the definition. Third we have is our eliminative symptoms. मैंने एलिमिनेटिव सिम्टम्स का MCQ बहुत बार देखा है, ट्रस्ट मी. सो सिम्टम्स which help to eliminate some unimportant medicines to facilitate the selection of similimum. Eliminative symptoms are the symptoms which help to eliminate some unimportant medicines to facilitate the selection of similimum. Now these symptoms are best to start with repertorizing a case. One should be very careful in selecting a symptom to be used as an eliminative symptom. Okay. We have one MCQ who introduced these symptoms in repertorization. So the answer is Dr. M. Tyler introduced eliminative symptoms in repertorization. Try to remember this. Fourth is determinative symptoms. Symptoms which help to find out or select an indicated remedy finally are known as determinative symptoms. Symptoms which help to find out or select an indicated remedy finally are known as determinative symptoms. This term was used by Dr. Garth Borek. The fifth is our negative symptoms. Symptoms which are expected, symptoms which are expected to be present in a case but they are absent, but they remain absent, are known as negative symptoms. Negative symptoms are the symptoms which are expected to be present in a case but they are absent. Now you can say the example. Absence of thirst in fever. You can have absence of pain in inflammation, etc. So अभी देखा जाए तो फीवर में थर्स्ट रहता ही है, बट अगर एब्सेंस है दैट इज नेगेटिव सिम्टम. कोई भी तरीके का इन्फ्लेमेशन है उसमें पेन नहीं है, दैट इज नेगेटिव सिम्टम. सिक्स्थ इज आवर accessory symptom. Accessory symptom is a long standing symptom which the patient thinks is a part of his normal functioning. So accessory symptoms are a long-standing symptoms which the patient thinks is a part and parcel of his normal functioning of life. Now these are very important symptoms for homeopathic prescription. Okay. Seventh is our alternating symptoms. Symptoms which manifest the partial picture of a chronic disease in one phase and are replaced by some other manifestation later are known as alternating symptoms. So alternating symptoms are symptoms which manifest the partial picture of a chronic disease in one phase and are replaced by some other manifestation later are known as alternating symptoms. एक्सेसरी सिम्टम्स एंड ऑल्टरनेटिंग सिम्टम्स दोनों बहुत बार पूछे गए हैं MCQs में AIAPGET में. इनके हमें अफोरिज्म नंबर पूछे जाते हैं मोस्ट ऑफ द टाइम्स. सो आई वांट यू ऑल कि कमेंट बॉक्स में जाके आप मुझे बताइए कि एक्सेसरी सिम्टम्स कौन से अफोरिज्म में है 6th एडिशन के एंड ऑल्टरनेटिंग सिम्टम्स कौन से अफोरिज्म में है 6th एडिशन के. 8 इज आवर क्लिनिकल सिम्टम. So symptoms which are common in a disease condition are known as clinical symptoms. Clinical symptoms of a drug represent symptoms which are not found during the drug proving but were found to be cured in clinical practice. Next we have is accidental symptom. So symptoms which are found prominently in a person but do not fit into the totality. So, accidental symptoms are symptoms which are found prominently in a person but they do not fit into the totality. Now these symptoms are present by chance and they do not help either in understanding the phenomena of the disease or in forming the totality. The last of the list, 10th, is our शीन सिम्टम्स. इसका भी MCQ मैंने काफी बार देखा है. नाउ दीज आर apparent symptoms which is caused by the excessive homeopathic medicines as a result of due to frequent repetition. Okay, so Sheen symptoms are the apparent symptoms caused by the excessive homeopathic medicines due to frequent repetition. So Sheen symptoms का मैं aphorism बता देती हूँ. I hope you guys remember कि आपको accessory symptoms and alternating symptoms का aphorism number मुझे comment box में बताना है. Sheen symptoms 6th edition of Organon में aphorism number 248 में है. Mark this guys, ये बहुत important, ये बहुत बार आ चुका है.
So this was all about today's video. Accessory and alternating symptoms के aphorisms comment ज़रूर करना and और कोई टॉपिक पे अगर आपको वीडियो चाहिए तो वो भी आप कमेंट बॉक्स में बता सकते हो. Till then, like, share and subscribe for more such videos. Thank you.